executive director here at the Colorado Coalition Against Sexual Assault. Lucky to have Tammy Hollister joining me as well. She is an HR professional, recently a board member with the Colorado Coalition Against Sexual Assault. So she has some insight into our field as well. Do you want to introduce yourself, Tammy?
Hi, sorry about the delay. Having fun with the mute button. I have 15 years, more than 15 years of HR experience, with the most recent 5 being in Colorado. So I'm happy to help with this. But Brie has done a beautiful job of pulling this information together. So
great. So as we get started, I do want to say neither Tammy nor myself are lawyers, so just keep that in mind. And for specific questions, we always encourage you to consult an HR professional or a lawyer. We decided to do this because, like you all, we're seeing a ton of information about different HR issues. I know you all don't have time to attend every webinar, sort through all of that information. So we wanted to kind of compile that and present it to you, and also offer our interpretation of that through the lens of our field and the particular way that our organizations operate. So just so you all know, I'll have a link at the end, but in general, we're trying to do that through CCASA for everyone. We're trying to sort through all the information we're getting. We have a web page on our website that is compiling that information, and then through these webinars, we're trying to distill that out to you. So what I hope to do with this webinar is just provide some general information at somewhat of a high level, and then we'll have some opportunities for you all to ask questions, but I also encourage you to reach out to myself, or if you are members of the Employers Council or have HR people on your boards or in your communities that you can reach out to, because every situation tends to be unique. And so oftentimes there's nuances that we need to kind of work through for your specific situation. So what I wanted to do, I have been talking with a couple folks, and that's one of the reasons why we decided to do this webinar, because we're getting kind of similar questions. So I am going to start with some basic human resources employment law information, because it seems like, and I know from my own experience in this field, came to be an executive director, didn't have really any HR background. I have been lucky to be able to attend various human resources trainings, have been in a position where I've been dealing with HR issues for over 7 years in this field. So I've learned some things along the way. So I just want to start out with some kind of basic things that some of you may already know. If you don't know and you feel like you have an oh shit moment, then don't worry about that. Everybody inevitably makes mistakes within the HR world, like any kind of law. There's kind of what's written, what's in practice, and many times the government doesn't give us clear answers until it goes through some kind of litigation process. So don't freak out if something seems new or you're worried that you weren't doing something correctly. The big thing is to, once you know, to try to do better. So I'm going to start off with the fact that there are 2 different types of employees, and depending on what type of employee they are is going to make how you respond in this kind of situation slightly different. So oftentimes, I think most of us think of employees in terms of, are they hourly or are they salaried? But those are not actually types of employees. Those are just ways in which we pay employees. So really what we need to be thinking about is in terms of these types of employees. So there are non-exempt employees, which means they are not exempt from overtime rules, minimum pay rules. Oftentimes these are the people who are paid hourly for the most part. You can pay them salary, but that gets a lot more complicated when you're dealing with overtime. So generally they're paid hourly. in Colorado, we have the Colorado Overtime and Minimum Pay Standards Order, which is how you have to treat them for overtime, rest, and meal periods. So if you have non-exempt employees, you have to keep these things in mind. With exempt employees, they're most often paid a salary, but just because you're paying somebody a salary does not mean that they're exempt. They have to meet the criteria for the relevant exemption. So I'm going to go over the 3 most common types of exemption that we typically see in our field. There are other ones as well, but these are the 3 most common types. So the first is, so here are the 3 most common types: executives or supervisors, administrative employees, and professional employees. So executives or supervisors have to supervise at least 2 full-time employees, and they have to have the authority to hire and fire, or effectively to recommend such an action. So if you have an organization, generally this applies to the executive director, but if you're large enough that you then have either an assistant director or a director of a program area who is supervising at least 2 full-time employees, then they would fall under this exemption as well. And in addition, they have to spend at least 50% of their duties of their per work week directly related to supervision. So yeah, just providing that guidance to those at least 2 full-time employees. Administrative employees may directly serve the executive. So this might be like an administrative assistant to the executive director. Oftentimes, this is also where like financial managers fall in, or an office manager perhaps. They have to regularly exercise independent judgment and discretion in matters. So if it's like an office assistant or an admin assistant, then they're not going to fall under this. Yeah, I think those are the 2 main things there. And then professional employees. And these are folks who have to have some kind of specialized knowledge. Usually this requires a particular educational degree. It could require training. We were looking into, given that in Colorado, people have to have the 30 hours of training in order to have privilege for doing sexual assault advocacy. I'm not 100% sure whether that would fit under here or not. That is something we're looking into, but I think in general, for your line staff advocates, I would consider them to be non-exempt, meaning hourly, until we get further guidance with that. So we'll have a chance in a little bit for you to ask some questions. If you have questions about these 2 different types of exempt or non-exempt employees, and then how you might classify somebody under these criteria as an exempt employee. But just remember, salary does not necessarily equal exempt. It's based on certain criteria, not how you pay them. So one other thing to note, I think it was like 2 years ago, there was a lot of talk about the federal government. Actually, it might be 3 or 4 years ago now, about the federal government raising the minimum bar for what you have to pay for someone to be an exempt employee. That did not happen federally. However, we did pass a similar law here in Colorado that takes effect next January 2021. So not only do exempt employees have to meet those criteria, but you also have to pay them a minimum salary threshold. If you do not, then they would be considered an hourly employee. So just for future planning purposes, especially since you know, we have some new grants taking effect next year. So hourly versus salary, this is how people get paid. So hourly workers get paid based on how many hours they work. I think we all understand that. Salary gets paid the same amount each pay period, regardless of how many hours they worked. So if for us here at CCASA, we pay bi-monthly, which means we pay 2 times a month, on the 15th and the last day of the month. So it doesn't matter how many hours are in that pay period, we pay the same amount. So we take an annual salary, divide it by 24, and then there's 24 pay periods. We get paid the same amount every single time. Doesn't matter if I work 45 hours in a week, doesn't matter if I work 35 hours in a week, I get paid the same amount. However, if you are paying someone a salary, but they're actually a non-exempt employee, which means that you have to pay them overtime, then you would still have to do that if they were working over whatever those overtime requirements are. So that's why it's often easier to pay non-exempt employees an hourly rate, because then it's much easier to figure out. So a question that I have been getting is around how to take leave. We've put a lot of information out there about paid administrative leave, or if folks are moving to teleworking and they're not able to work the full 40 hours a week, or just don't work the 40 hours a week. So how would you kind of fill that in? So for non-exempt employees, usually whatever your leave policy is, but usually people are taking those in 1 hour increments. So if I am a non-exempt employee and, for example, I have a doctor's appointment and I need 2 hours off of work to go to the doctor, then I would take 2 hours of paid leave on my timesheet. Now for exempt employees, we can't treat exempt employees as hourly employees, because if we do, we run the risk of the employment department coming to us and saying, well, they are then an hourly employee, which then means that you may have to, or they're non-exempt employee, you may have to pay them overtime. So this is where a lot of people aren't really sure what to do if you have an exempt employee who needs to take 2 hours off during the day to go to a doctor's appointment. Usually exempt employees most often have to take a full day of PTO. You can also do a half day of PTO if that, in fact, we do that at CCASA, if that feels a little more fair. So if I took a 2 hour appointment as an exempt employee, I could either, one, make up those 2 hours later in the day, later in that week, or I could not work those 2 hours and I would just work a 38-hour week instead of a 40-hour week. The idea with exempt employees is that over time it evens out. So some weeks I may work more, some weeks I may work less. It'll average out to 40 hours a week. However, if I have to leave the office, say for 4 hours, and my policy says that I have to take time off in half-day increments, then I would have to put in my 4 hours of work and take 4 hours of leave. But I can't do it in any less than 4 hours of leave or a half-day increment, because otherwise I am then being treated as an hourly employee. So again, we'll have a chance for folks to ask some questions around that if you're unsure of what that is. Another thing to keep in mind is that when you need to start the pay clock. So for a non-exempt employee, a lot of us are tracking time either by 10-minute increments or 15-minute increments. Colorado state law says that any task lasting more than a minute has to be compensated. So if you're tracking things in 15-minute increments and somebody works 1 hour and they get paid $15 an hour, then you're counting 15-minute increments, so 15 minutes is a quarter of an hour, then you would have to pay them for that 15 minutes of time, even if they only worked 1 minute. They have to be compensated. For exempt employees, what that means is if you are requiring them to take leave in full day increments, if they work 1 minute of a day and that's it, you still have to pay them for that full day. So that's just something to keep in mind. I think this is really important to keep in mind when you're perhaps shifting to telecommuting, especially for hourly or non-exempt employees, because if they go over the 40 hours a week, then you're moving into the overtime territory. So if folks are working from home and they're checking their email like 12 hours a day, if they work for that more than a minute, they have to be compensated and they need to report that. So you want to set some boundaries on telecommuting so that folks are staying within that 8-hour range. That also may mean that you as a supervisor want to think about, like, I know I will sometimes shoot off emails at 11 o'clock at night, not expecting that people are going to check their email or respond, but just know, particularly in this moment of time when people are looking for information, a lot of people are constantly checking email or checking internet. And so if you send something off and then they read it and respond, that's them working. So I would encourage you all to limit your communications and requests for information to whatever your regular workday is or whenever you expect people to be checking email and responding to email, just so that people aren't tempted to respond outside of what those set hours are. I think I'm going to go ahead and open it up to questions at this point, and then we're going to talk a little bit about paid administrative leave and telework. But before we move there, I just want to see if anybody has questions about some of this kind of baseline stuff we've talked about so far.
Hi, Brie. Yeah, a couple of questions came in. The first one is, are nonprofit agencies required to pay an overtime rate at time and a half for all hours over 40 hours in the week?
So nonprofits fall under the same laws as other organizations. Tammy, what are I know it's not just 40 hours a week. There are some other guidelines around overtime pay.
For Colorado, it's 40 hours a week.
Can you move closer to the mic? I can't hear you.
Oh, sorry. Colorado has additional provisions if someone works more than 12 hours in one day. I'm not sure what the law is for Illinois or New Mexico, but that they may have, some states have those additional rules as well. But certainly here in Colorado, if someone works more than 40 hours in 1 week or 12 hours in one day, then they are eligible for overtime, then that's when they would need to be paid overtime.
And that's at the rate of 1.5.
Yes. Yeah.
Yeah. So there's no separate rules for nonprofits. We fall under the same rules as any other business.
Great.
Other questions?
Yes. The next question is, does it depend on the size of agencies and number of employees? And I think you answered that, but just wanted to put that out there.
Tammy, am I correct in saying that it does not matter what size agency or how many employees you have?
I believe that it doesn't, but this is an opportunity where you may want to consult a specific HR professional about your specific business.
Great. And then the next question is, our nonprofit is having us take sick leave and or vacation if we do not complete the 8 hours. Is that okay?
Are you exempt or non-exempt?
Yeah, so it will depend on whether you fall under as an exempt employee or a non-exempt employee. Also, I will talk in a minute or towards the second half of this about the new federal, what does it even stand for? Families First Corona Response Act. However, that does not take effect until April 2nd. So at this point, if you are a non-exempt employee, which most often means you're paid hourly, then if you are not working 40 hours a week, they could require you to backfill that with sick or vacation, but they could also just say, well, you worked 32 hours a week this week, or this week, whatever, and we're only going to pay you for 32 hours. So if you want to maintain the same paycheck because you have your bills to pay and you want to, have that money, then you can use your sick or vacation leave. But if you're willing to only be paid for 30 hours a week, then you could choose to do that as well. I don't know the legalities. I can look into it of them requiring you to use that. Yeah, but if you are an exempt employee, then again, unless you, as an exempt employee, they should only be having you take leave if you in either those 1 full day increments or half day increments, depending on what your policy is.
Right, and just to clarify, they did say later on that they were exempt. The next question was, you mentioned DVSA training might lead to consider an employee exempt. When will you know if this is actually approved? Is it by CDLE?
Can you repeat that? Sorry.
Yes, so the question is, you mentioned DVSA training might lead to consider an employee exempt. When will you know if this is actually approved?
It's not a matter of something being approved necessarily through CCASA. Designating individuals as exempt or non-exempt is very technical. And as someone who's been in HR for a long time, this is an area where I would still ask for support from the Employers' Council if we were getting into any area that was even slightly grey. There is a lot of legislation around what constitutes someone who is exempt or non-exempt, and this is somewhere where we can provide some additional information when we have it. If we're able to provide some clarity around that, we absolutely will, but this is something where organizations should definitely speak to the Employers' Council or their own legal advice to get more clarity on that, because it will come down to the duties of the position, specifics around training, and then one of the pieces that Brie mentioned for administrative folks around autonomy and how much independent decision-making decision-making responsibilities a position will have. And again, that comes back to the position, not the person. So there's a lot of gray area in there. I don't believe that CCASA will be able to just say, sure, all of these folks are exempt. We can certainly provide some guidance, but that's an area where people should look for additional information.
Yeah, so unfortunately, like many laws, there's not often a clear-cut answer to things until they get litigated and somebody decides that this is how it needs to be interpreted. So we will ask that question and see if we can provide a little more guidance around that, but we may or may not get a clear-cut answer, and it may depend on the specific job description that your agency has.
Great. And then the last question was, and what about staff who are expected to be bilingual in ASL and English and knowledgeable in regards to a specific culture, in this case, deaf culture? Would they be considered professional employees?
That is something I would probably want to talk to Employers' Council about as well, or a lawyer. Again, the definition of the professional exemption is around having a specific course of study or training. So I think that would depend. Yeah, I'm not sure I can answer that.
Great.
We will try to find out more information and let you know.
Great.
Great.
Do we have time for one more, or do you want to move on? And we'll
Sure, let's do one more and then we'll move on. We'll have more opportunities for questions too.
Perfect. So this last question then is, does the agency have the choice to make someone exempt versus non-exempt, or is it purely up to the definition of the position?
It's purely up to the legal definition of what qualifies as exempt under the law. So agencies need to be following the law.
You could potentially choose to make every single person in your organization non-exempt and pay everyone overtime and track all of the hours very, very closely. But that would get very expensive very quickly. So if you're looking for a choice, that's the only one you have, is to make sure everyone gets overtime. But that would also undermine the positions ever being exempt in the future. So no, it is definitely set out by law.
All right, so we're going to talk briefly about paid administrative leave. We have a lot of resources, as I said, on our website. We have some examples. We are getting more examples every day. So if you don't find what you need on our website, then please reach out to us and we can help you. We can look at, what your existing policies are and help you modify those or help you come up with something brand new. So a reason why you would want to have paid administrative leave versus just standard vacation or sick leave, generally the main reason is the second bullet point there, is that the entire agency is closing because it's unable to provide services. So with natural disasters, blizzard, people can't get to the office, whatever, the agency has to close. We are strongly encouraging, as are the funders, that you not close the entire agency, because the services you all provide are critical crisis services, and at the very least you could continue providing crisis intervention and support over the phone. However, you may also want to consider paid administrative leave if you have a specific position that needs to stop working or needs to reduce hours because they're not able to perform their duties given the current circumstances. So I know folks have prevention staff who work in the schools who, given that the schools are closed, may not be able to work at all. So paid administrative leave would provide them with the opportunity to continue getting paid. There are some other options for that we'll talk about as far as unemployment. But as you all know, unemployment does not pay as much as someone would normally get paid. Also, again, we strongly encourage you, as do the funders, that you look at how you can shift folks around so that they can help in other areas of the agency. So if you have staff who typically are in the schools and they can't be in the schools right now, can they help answer the crisis line? Can they help provide other advocacy services so that they are still working during this time and could still get paid? You would need to talk with your grant manager about that to make sure that you could shift grant funds around to pay for their time if they are not currently on your grant. So definitely be talking with your grant managers before you shift folks around and make sure what makes sense and what you can do. And of course, we are all limited by our funds and how much money we have. The grantors can't necessarily increase our grants. But if you have funding that pays for those folks to be in the schools, would that grantor or that funding allow you to shift and pay them to be doing other types of work? So that would definitely be things to consider for paid administrative leave. Either the entire agency closes or certain positions can't work or have to reduce their hours, so you want to be able to fill in so that they're still getting paid the same amount. This is definitely a short-term solution. If our situation starts going into months, then this could be problematic, and I would encourage you all to talk with the grantors about this, because we still have to meet our grant goals and objectives or have good reasons for not, but this would definitely be an ongoing conversation. So this is an example of a paid administrative leave policy, very basic. And I want to note that policies are different than procedures. So in addition to having a policy, you would want to have a procedure about how somebody requests paid administrative leave, how it's approved, how it gets paid out, how you track it, all of that. But a very basic policy so that you have a policy in place if your agency doesn't currently have one. Would just be a simple statement like this: in the event of uncontrollable factors, such as these things, insert your agency name, may have to temporarily reduce or cease business activities. If this were to occur, staff may be placed on paid administrative leave. We definitely encourage you to put one of these in place, even if you don't think you will need it, just so that you have it there as a backup, because you never know. And if you don't have it, then grants can't cover this. So we have gotten guidance both from OVW as well as from the Office for Victims Programs here in Colorado that grants can pay for administrative leave if you have a policy. So definitely make sure you have a policy. So tracking and reporting paid administrative leave would be similar to other forms of leave. So for non-exempt employees, AKA hourly employees, you would just track it like other forms of leave. If somebody worked 32 hours a week and you needed to make up the other 8 hours, then they would put in 8 hours of paid administrative leave. For exempt employees, again, you would only track and count it as paid administrative leave if they needed it in a full day, or if you had a half day policy, then you would do that. So somebody could work 2 hours, an exempt employee could work 2 hours in one day. If you have a half day leave policy, they would put in 4 hours of paid administrative leave. That would still mean they only worked or were accounting for 6 hours of that day. That's just the way that exempt employees work. As I said, sometimes you'll go over, sometimes you'll go under. It evens out over time is the idea. We cannot change their pay just because they work 2 hours less in that day. So I want to talk a little bit then, like, how does that work? Is for exempt employees, rather than allocating time and pay based on hours, you base it on percentage. So if normally your full-time employee is considered 40-hour work week, but this particular week the employee only works 30 hours, then that 30 hours becomes what a full week is for them. If 15 of those hours are spent on grant activities, then you would allocate time based on the percentage of time spent on that grant, not on the number of hours spent on that grant. So if their full time was 30 hours, they spent 15 of those on a grant, then 50% of their salary would get charged to that grant. This is the same thing for when they work more than 40 hours a week. So if somebody worked 45 hours a week and 15 of those hours that week were spent on a grant, then you would take 15 of 45 hours, which is 33%, would get charged to the grant. So you can see over time, if they're working over sometimes and under sometimes, it will even out because you're not using an hourly pay rate, you are using a percentage base for their time. Also, you want to always report the actual hours worked, whether they're exempt or non-exempt. You should not just be saying, oh, I worked 40 hours a week, even if you worked 32 or if you worked 45. You should put in the actual amount of hours that you worked and then do that allocating for exempt employees based on the percentage of time. One other thing you might want to consider for exempt employees, if this is more of a long-term solution, I would not use this for a short-term solution, but you could always change. So if somebody is gonna, for the next, if the position's basically becoming a 30-hour-a-week position, then you could change it from a full-time FTE to a 0.75 FTE. That would mean their salary would change accordingly as well. If that position is now becoming a 30-hour-a-week position, then unless you are actually increasing their pay, if they would have gotten paid $40,000 at full-time, they're now 0.75, then you would be paying them 0.75 of that $40,000, which is $30,000. We'll talk a little bit more about Colorado unemployment insurance in a minute, but if employees' time is reduced to less than 32 hours a week as a result of COVID, so they're in a position that there's no way they can do some of their essential functions, and so they can't really work 40 hours a week, they're working less than 32 hours, then they would be eligible for state employment for those decreased hours. So we'll talk about that a little bit more, but just know if we think that this might actually impact us for 3 to 6 months, then, and you have a position that just is not going to be able to work 40 hours a week given the current conditions, you could change it to a 30-hour-a-week position, and then that employee could apply for unemployment for the difference. So before we'll talk, actually, let's do another round of questions about that before we get into telework. So anything with paid administrative leave or changing people's hours.
So Brie, folks may be typing in, but as of right now, we don't have any questions in relation to hours.
Okay.
Yeah.
Great. Well, we'll talk a little bit about telework, and then we'll take a break there to answer questions. So folks are being encouraged to work from home as much as possible. I know here the governor just put out something that he wants to see that employers reduce the number of folks who come into the office by 50%. We've been talking a lot about this through CCASA. We've got our webinar on Friday that will talk about how to do telecounseling or teleadvocacy. So if you haven't ever done telework before, we can work with you specifically around creating a specific policy and specific procedures for doing that. But I just want to give kind of a broad overview of things you should be considering if you're moving to telework. So definitely you want to have a policy in place that will cover you as an employer. You want to have things that talk about how telework is no different than working from the office in terms of the work day, especially if you've got those non-exempt employees and you need people to stay to 40 hours a week. So all the employment conditions remain the same as far as they have to track their time. You still would have to pay them overtime for non-exempt employees. They would still need to take leave if they are not working for an entire day if they're exempt, or they need to take some time off during the day, a couple hours during the day if they're non-exempt. So all of those employment conditions still remain the same, whether they're working from home or they're working in the office. You also want to have an agreement, particularly for those non-exempt employees, but really for anyone, about what hours you expect them to be available and to be responding to emails, as well as what hours you expect them to not respond to emails, that they cannot work during these times unless they have prior approval, will help protect you with some of those overtime issues. And then, of course, supervising people remotely gets a little more complicated. So it's really important to have clear expectations around not only times they should be available, but what they should be doing. Supervision and management really should be focused on those expectations of what kind of outputs do you want, what kind of outcomes do you want to see, regardless of whether you're working from home or in the office, because somebody could go into the office and sit in their office for 8 hours a day, doesn't mean they're working, right? So it's the same kind of thing. Supervision and management really should focus on, are you doing what I need you to do? So you need to clearly expect what you need people to do and have some real concrete or tangible outputs or outcomes that you can then check back in on and say, did you do this? Did this happen? If it didn't happen, why not? Is there a good reason for that or not? And if things haven't happened, then that's when you need to do some supervision around expectations and getting people to do what you need them to do. So make sure you have a policy. We have some, I believe we have some example policies on our website as well. We can also work with you for your specific situation because, you know, working from home may look very different for different types of positions in your organization. Other things to consider if you have people working from home is, do they have the needed equipment or technology? So do they have access to a computer if they need it? Do they have access to a safe and secure computer if they're going to be pulling up information that needs to be confidential? Do they have adequate and safe and confidential workspace if they're going to be providing advocacy over the phone? Do they have a private place that they can go to do phone calls where it can be confidential and they're not going to be overheard or disturbed? Also, you know, do they have a workspace? Do they have a table or a desk that they can use to set things up? Do they have phones? Most people have phones, but you know, whatever it is they need to do their work, or do they have access to that? Also, can you provide reimbursement if they are using their internet, personal phone, any, you know, personal equipment or supplies? Are you able to help reimburse them or pay a portion of that since they're doing that from home rather than from the office? And also, I would strongly encourage you to contact your insurance and see if they have any specific information that they would want you to get about the home work environment in order to ensure that you are protecting your employees and that your insurance would cover anything. So both workers' comp, if folks are working from home and they get hurt while they're at home working, they are eligible for workers' comp insurance, and they should follow the same procedures as far as filling out a workers' comp claim, et cetera. So they should know that, but also your liability insurance, I would talk to them to make sure that people are set up in a way that you are covered for any liability. So definitely talk with your insurance. And then other things to consider as far as shifting employees around, like I said, can you have them shift to help cover other needs if they're in a position that isn't able to perform their duties right now? And then if for some reason you can't keep a position at this time because there's just, you can't use them, you're not able to shift money around to pay them so that they could do something that would be useful to you, or if you need to decrease the position's time to that less than 32 hours a week, then employees can apply for unemployment insurance in Colorado. But always keep in mind, unemployment is not the same rate that they would be getting if they were getting their regular pay through you as an employee. So, I would definitely try to find other solutions before you have to do that. So we're going to take some questions again, if there are any, and then we're going to move into the Families First Act.
Great.
Were there any questions?
Yeah, we did have quite a few questions come in, Brie. So the first one is, does the employer get in trouble if you claim unemployment, or does that cost them? If not, why do employers always fight unemployment claims?
So there is a cost to employers, not your specific cost, but employers pay a rate into unemployment insurance. When they have a claim against them, that increases the rate that they have to pay. So they are not directly paying for a particular employee's uninsurance or unemployment benefits, but it does affect the amount that they have to pay into the unemployment pool. So employers may choose to fight unemployment if they don't, if they don't feel like they want to pay into that pool. Now, I was on a call this morning with Employers Council, and as far as the unemployment benefits, specifically for what's happening right now with COVID, we don't have an answer on if that's going to affect employers' unemployment insurance rate at this point. My hope is it doesn't, because this is impacting everyone, but we don't really have a good answer for you on that yet.
Great.
Next question.
Yeah, sorry, I was trying to find my mute button again. So the next question is, can you clarify when paid administrative leave can no longer be used?
So, I mean, there isn't anything, unless you have something written into your policy that says we only pay up to 12 weeks of paid administrative leave, then there isn't anything in law that says you can't use it anymore. I would just encourage you to have a conversation with your funder about that, because if we are getting into the 3-month territory, there could be other implications as far as from the grants, from the funders versus and what they're willing to cover with grant money.
Great. And then similarly, as far as administrative leave, how should hourly employees track their time if they are working for part of the day, but they don't have 8 hours worth of work and are getting administrative leave for the remaining time?
So for non-exempt, most often hourly workers, then I would just fill in the remaining hours needed to reach 8 hours. So if they work 6 hours a day, then they can take 2 hours of paid admin leave. I know on our timesheets for CCASA, we have we do combined paid time off, so we don't have separate sick or vacation. So that, I would track PTO under that, but we also have a column for other leave. So you might want to have a way of distinguishing between your regular sick, vacation, PTO time versus your administrative leave time, just so that you have that for tracking purposes. But otherwise, I would do it the same as you're doing for any other leave. Again, for exempt employees, unless they need a full day off or your policy says half days, then they should not be tracking per hour.
Great. And then we have one specific, I have a peer counselor who operates as an independent contractor. Do I need a telework policy for her during this time? She normally meets in our office, but her and the client set the time, day, etc.
You probably want to have some kind of I would say, yeah, you probably want to have a policy or some kind of agreement around confidentiality, how that's going to work. It is a little different with contractors versus employees because they are independent. And so, you know, we can talk about that a little bit more, but I would still encourage you to have a policy so that you have clear expectations on what is required in order to provide those services and get paid, and how that's going to happen, so that you're ensuring that you're covering any kind of confidentiality, liability, etc.
Great, and the questions keep coming, so Brie, let me know when you wanted to pause, if you wanted to pause to continue with content. The next question that came in was, what is the name of the employment council we can contact for specific questions?
So formerly Mountain State Employers Council is now just called Employers Council, but you have to be a member in order to access their services for specific questions. They do have some general information on their website that anyone can access. CCASA is a member of Employers Council, so if you contact us, we can work with you to try to get your questions answered about your specific situation. But yeah, you would have to be a member of theirs, or if you're a member of some other HR group.
Hello, Brie, I think we lost you.
That was it.
Sorry. Great. And so then these next few questions, I'm going to lump them together because they're very similar. So should our agencies be responsible for providing things like desks, office chairs, and reimbursing for internet during this time of telework, even if it's mostly a temporary time period? And if so, how does an employee ask for those things, including potentially being reimbursed for having to use personal Wi-Fi?
So I don't know that I can answer yes or no as to, does your agency have to do these things? I think they should be seeking guidance from your liability and workers' comp insurance as far as a workspace and what that minimum requirements for that should be, what that should look like for safety. And again, I strongly encourage employers to look at reimbursement or stipend if folks are having to use their own resources. But I think that's, you know, something you can ask of your employer, but it doesn't necessarily, there's no law that says that they have to do that. I don't know, Tammy, if you have other thoughts.
Yeah, you're absolutely right that there is no law around them having to do that. And this is a complicated moment for everyone. We want to balance our own needs in having the things we need to work from home with also the understanding that, you know, this is not necessarily the organization's preference either. So I know of organizations that have allowed people to take home some of their equipment, monitors or keyboards. If you're doing that, you want to track it really thoroughly. Most people do have some form of tables and chairs in their own homes that they could be using. So there's just going to be a balance that people will have to come to with their organizations.
Thanks, Tammy. Yeah, I mean, I would say definitely if there is an increased cost to you, I would advocate for yourself or your organization that they help pay for that increased cost. So if you have a phone plan that you know, is only for a certain number of minutes and you end up going over those minutes because you are conducting work business, then I would say, yes, ask your employer if they can help pay for your phone bill. If, like me, my phone plan is unlimited, so it doesn't really matter, then I understand that my employer is also having, you know, having to deal with this situation, and there aren't necessarily more financial resources available. I am not asking for anything because I'm not paying anything that I would otherwise have been paying.
Great.
Are there more questions?
Yes, there's a couple more. I'm reducing hours to basically 0 for an hourly employee and a practitioner, but I don't want for them to lose health insurance benefits. So I'm going to pay them a minimal amount to keep them on insurance, and I will cover their premium. Is this okay?
I would speak to someone about this or get specific advice, because if they're an hourly employee, you don't want to be paying them if they're not working hours. There are certainly options to furlough people, though, so that they do keep their health insurance even while they're not working. But this one may be one where you need specific advice. And I also appreciate you looking after your people.
Yeah, that's great. I would talk with your specific insurance provider as well. CCASA uses a broker, and so we're able to go ask our broker questions, because if you have an insurance policy, if your policy is that somebody has to work X number of hours in order to be eligible for insurance, then you would need to change your policy so that you're in compliance with your own policies. So definitely we can talk more about that with you specifically, as well as I encourage you to reach out to your insurance provider and HR folks to make sure that you're following your own policy and you're doing the best thing that you can. But that's awesome that you are trying to continue providing that vital insurance at this time.
Great. And then this seems to be the last question for now. Would someone have to use their accrued paid leave time before administrative leave?
I think that will, again, depend on your agency's policy. So I would have your policy address that as far as expectations of how leave gets used or not. Yeah, I wouldn't say that that's a legal question. It's more a practical question for how your agency is going to implement that. But as I talk about the Families First Act, that we'll get into that a little bit more. Are there any other questions?
One just came in. Let me run this real quick. It says, would it make sense for our agency, whose policy it is that employees working 32 or more hours are considered 1 FTE, to change from 40 hours down to a minimum of 32 hours, but okay if they work more than 32 up to 40 as exempt employees, just for the time period of COVID-19? Not sure if I'm making sense. Can email you directly, Brie, about it if that's better.
Yeah, so I mean, I would not necessarily reclassify positions for what we hope to be a temporary situation. I would just, again, for exempt employees, it doesn't matter how much they're working, you're paying them the same amount. So even if for this situation they're just going to be working 32 hours a week, then I would just base your timesheet on 32 hours a week and do the percentage allocations. If you reclassify positions and say, okay, well, for our agency, 32 hours a week is considered full-time, then if you want to switch back later on to 40 hours a week being full-time, you would need to, again, reclassify. So I would say for now, probably not. Just know that your exempt employees may not be working 40 hours a week.
Great. And that's all the questions for now, Brie.
Great. So I wanted to give you an overview of this new federal legislation that got passed late last week. because this will play into leave, both any standard leave that you have, as well as if you have a paid administrative leave policy. Know that this does not go into effect until April 2nd. It got passed on, I want to say the 17th, and it had a 15-day window for implementation for when it took effect. So anything that happens up until April 2nd does not apply. This is not a retroactive act. It becomes effective on April 2nd. So this act created or had two pieces to it. One was around emergency paid sick leave, and the other is around emergency family and medical leave. So it basically is expanding FMLA specific to the coronavirus. This act is in place through December 31st of this year. So it could get extended beyond that, but right now it's in place from April 2nd to December 31st of this year. So the first part about the sick leave. Folks under this act will have 80 hours, so essentially 2 weeks if they're full-time employees, of paid sick leave if they have or need to be diagnosed or are quarantined for coronavirus. So because this just came out, there's not a lot of guidance around it right now, and there aren't specific things in place for like how you report this or how you get reimbursed for this. That will hopefully be forthcoming before it takes effect, but we'll let you know once we know. So on the call this morning with the Employers Council, there's no paperwork right now that you need to fill out. I think it's just at this point kind of good faith. If an employee tells you that they are getting diagnosed or they need to be quarantined for coronavirus, I would take them at their word until we have further guidance. Also, because a lot of doctors' offices are moving to doing telepractice, so folks aren't coming into the office, they may not be able to get a piece of paper from their doctor that says they need to be quarantined. So we have just about 2 weeks or a week and a half before this actually becomes effective. So hopefully we'll have some more guidance before then. So this is just kind of an FYI for you right now. So 2 weeks for the person if they need to be diagnosed or quarantined, 2 weeks paid sick leave if they need to care for a family member who is impacted by coronavirus, either diagnosed or quarantined, and 2 weeks paid sick leave if they're caring for a child because their child's school is closed. So this applies to all employees regardless of how long they worked at the agency or how many hours they work, so that if they're not full-time, if they're half-time, that time gets prorated. So if somebody only works 20 hours a week, they would essentially get 40 hours or 1 week at full-time, but 40 hours of paid sick leave. So that gets prorated based on their regular amount of time that they work. This, the way this works is that this will get reimbursed to the agency. So this is separate from any paid sick leave that you have as your own agency benefit. This is something that is being offered by the federal government. Agencies will pay this out and then get reimbursed for it. So as I said, part-time employers get a proportional amount. One thing to note with the Families First Coronavirus Response Act is that an employer may not require an employee to use other paid leave before they can use this paid sick leave, because this is something being offered by the federal government. Even though it's initially coming out of your pocket as an employer, you will be reimbursed for this. So you cannot require that an employee use whatever paid leave benefits you have before they access these paid leave benefits that the federal government is offering. If they end up using the full 80 hours and run out of the government paid sick leave, then they could use whatever leave you offer as a benefit through your agency. Otherwise, if they don't have any other paid leave, then it would be unpaid. So sick leave would be paid at their regular rate of pay. There are maximum amounts. I have broken it down into hourly and annual salary. I highly doubt that anyone in our field, at least in Colorado, makes $132,860 a year. So you're probably not going to hit that max amount. There are two different amounts that can be paid. If you are sick or seeking a diagnosis, then it's up to $511 per day, but it would be whatever your regular rate of pay is. If you're caring for a family member or you're caring for a child, you might not get paid as much. If you get paid over $52,000 a year, you might get paid slightly less because the maximum rate for that is $200 per day or $25 an hour. All right, so sick leave. The second part of this is the Family Medical Leave Act addendum. So just like FMLA in general, this adds on to it. So it would provide for 12 weeks of protected leave to any employee. They have to have been employed for at least 30 days. So if you just hired somebody, they would not be eligible for this until they'd worked with you for 30 days. And if they're unable to work or telework due to having to care for a son or daughter who is 18 years or less. So FMLA will cover the employee as long as they've been there for at least 30 days. And it will also cover for employees who can't work because they have to care for their child. This does not cover an employee if they have to care for another family member. So that could be covered under the sick leave for the 2 weeks, but anything after that wouldn't be covered. FMLA could come in to cover an employee who's used the 2 weeks of sick leave and then still can't work because they have to care for their child. Then FMLA could then add on to that. Again, part-time employees would be prorated based on their average number of hours that they worked. FMLA does not cover the first 10 days. They would be unpaid, and that's where the sick leave would be joined with this. So they could be paid through the sick leave part of the act for the first 10 days, and then paid through the FMLA part of the act after then for up to 12 weeks. If they've used the sick leave for something else or they've run out of sick leave, employees may choose to use any other PTO benefit that they have, but employers cannot require them to use a PTO benefit. So again, this act is a federal benefit versus whatever benefits you provide as your organization. Sorry, my dog is here helping me do the webinar. So you cannot deny somebody access to this federal benefit by requiring them to take your organizational benefit first. They have the right to this federal benefit. And then if they use up all the federal benefit, then they could use whatever organizational benefit that you provide. One of the other differences between the paid sick leave and the FMLA parts of this act are the paid sick leave. Again, you would pay at their normal rate unless it is above whatever the maximum is. FMLA is only paid at 2/3 of their regular rate. So it is a little less than what they would normally be paid. As I said, FMLA is not available if the employee has to care for a family member other than their child. It doesn't guarantee pay, it only guarantees job protection. And people may qualify for regular FMLA if it qualifies as a serious health condition. So, and then under COVID, of course, COVID is a serious health condition, but they have to be able to prove or make a case that they need this because of the serious health condition. So clearly COVID falls under that. As I said before, if they're not eligible for FMLA, they could use the sick leave, but that's much shorter. It's only the 80 hours, where FMLA is up to 12 weeks. So for you all to know, again, we don't know the specifics on how this is going to work for claiming and getting reimbursed. They haven't given us that information yet, but businesses would pay the employees for this sick leave and then would be reimbursed through IRS, federal government. At this point, they've said you'd be reimbursed within 3 months. I heard this morning on Employers Council that they're looking at trying to have those reimbursements within 2 weeks so that people aren't out money. But we don't know how this is going to happen yet. Once we do, we'll let you know. And then, as I said, this goes through December 31st at this point. But again, it doesn't start until April 2nd. So if somebody needs to take leave now, up until April 2nd, this federal resource is not available. So they would either need to be using whatever leave they get through your organization or taking unpaid leave. So that's unfortunate if people are sick right now, but this does take effect April 2nd. So are there questions about that?
Yeah, we have a few. The first one is, do these regulations, FMLA and sick leave, do they apply to employees whose children are home from school, but the school is providing e-learning for the remainder of the school year?
My understanding is yes. If you are unable to work. So if having your children at home makes you unable to work, then you would be eligible for this, even if they're getting homeschooling, because you still have to be there to help them and monitor them and whatever. However, if you are able to work, or at least work part-time, then you would not be eligible or fully eligible for this. It would only be for the portion where you are actually unable to work.
Great. And then this question came in a few times in different ways. Is the FMLA only applicable to orgs of 50 or more employees, like regular FMLA? There was another comment of, we understood that we were too small of an org to be affected with this FMLA. Did that change with this act? Yeah, that's been a
yes. So the Families First Coronavirus Response Act applies to all organizations with less than 500 employees. So regular FMLA is still its thing. Only the Families First Act portion amendment to FMLA would apply. So if somebody's pregnant, has nothing to do with COVID, you're still following, my understanding is you're still following regular FMLA. However, if they need leave because of COVID, then it would fall under this amended piece through the Response Act. Now there is a piece of the act that says for employers with fewer than 50 employees, if it would be a financial hardship, essentially if you were going to go bankrupt by following this, then you could apply for a waiver. They have not given us any guidance on how you would apply for that at this point. And I would say for most of our organizations, because because we are being reimbursed, you will get reimbursed for leave that falls under the Act. So it's unlikely that they would find this to be a financial hardship for you, because you will get the money back.
Great. Another question that came in about FMLA was for the 2/3 pay with FMLA, is it the employer who has to pay that after 10 days?
Yes, so with the Act, the way it works for both the sick leave and the FMLA is the employer, as the employer, you will pay and then you will get reimbursed. So you have to pay up front, but if it falls under the Act, you will get reimbursed.
Great. And then another question, what about in cases of a business that has been mandated to shut down? So we are not able to be open based on health department mandate as a non-essential medical facility.
I mean, I don't know what your situation is. I would say I'm thinking of the community-based nonprofit advocacy organizations. Again, to the extent that you can provide services over the phone or over the web, then please try to do that, because we are essential critical services. If you are attached to a hospital or something and you have to shut down and cannot provide services at all, then yes, you would fall under this Act.
Great. And then
also, you could apply for unemployment through the state unemployment.
Perfect. And then someone is asking where we can easily find this legislation, the FFCRA, the Families First Coronavirus Response Act.
So I don't know that I have the direct link here. So here are some resources. The Employers Council, Allegra Group is an insurance broker. They provide some summaries of this legislation. We can also, I believe, on our crisis management resources page we'll make sure we have a direct link to the Act on there, and other information as we get it, we'll add to there.
Great. So it looks like right now that's all that's coming in, Brie.
Great. So you will get a copy of these PowerPoints. We're also going to be sending you a chart that we got from our insurance broker that kind of lays out some scenarios of like what source would pay for what depending on the situation. So when would the FFCRA sick leave or FFCRA FMLA come into effect versus what would your agency cover if it offers paid leave benefits, so that it can help you kind of look through some different scenarios. Again, feel free to please reach out to us for specific questions, because every organization works a little differently. So often there's a lot of nuance in how something might be answered. We will do our best to gather those answers for you. And then if you have other things that you would like to see from us to help you both in the kind of administrative management side as well as how do we provide services in these times, please let us know so that we can pull together more resources, webinars, etc. for you. We know that you all are busy trying to provide services and support survivors, and there's a ton of information out there and coming out. So we're here to weed through all of that for you to help answer your questions, so you don't have to spend your time doing that. You can keep your focus on serving survivors. So please There's a link to our TA form. If you're not sure who to contact, you can also email staff directly, and we will keep you updated as we learn more about these things. If there aren't any other questions, then I think we are done.
Yeah, we don't have any other questions, Brie. I just want to say thank you for providing this information for members and for folks. Thank you all who were on the call, on the webinar, for being here. Like Brie said, any questions that you have, feel free to reach out. I will be sending here in just a few minutes a follow-up email with the PowerPoint, with that handout that is listed here as one of the resources, my contact information, Brie's contact information. So if you don't know where else to start, you have those 2 emails from CCASA that you can reach out and see what it is that you're needing. There's also that survey. Please, please, please don't forget to fill that out. Again, there's one specific question for you to let us know what other COVID-19 related information you need at this time. So we're going to be looking through that to be able to provide as much information as you all are needing that we can provide. Again, as a reminder, to start us off with that, we are going to have our webinar on Friday with Jackie Strom from PCAR and Erica Brosig from Victim Services, Inc. They're going to be talking to us about Telecounseling 101, providing services for survivors. So we do hope you can join us. Check out our calendar or send me an email reply with information on how to register for that. Again, thank you for attending, and we will hopefully talk to you all soon. Thanks again, Brie.
Thanks.